Alright folks, today we are diving into the Burgess below knee amputation, BKA, technique, a game changer in creating a comfy stump for prosthetic use. This method shakes things up from the traditional BKA by focusing on myodesis, where muscles are fixed to bone, and ensuring a tension-free closure. Let's break down the key surgical steps and anatomical structures you'll encounter. So, here's what happens. 1. Preoperative planning and marking. You will start by deciding the level of amputation, generally about 12 to 15 cm below the tibial tuberosity, or longer if the tissue looks good. The Burgess approach uses a long posterior myocutaneous flap and a shorter anterior flap for solid, vascular coverage. 2. Incision and flap creation. For the anterior incision, make a curved cut starting medially and laterally just below where you plan to cut the bone. The posterior incision is a longer, U-shaped flap extending downward to ensure there's enough soft tissue. Here are some key structures you'll encounter. Superficial veins, great and small saphenous. Tie these off to prevent hematoma. Saphenous nerve, medially, and choral nerve, posteriorly. Cut these under tension to avoid neuroma. 3. Division of muscles and neurovascular structures. Cutting the muscles and nerves is crucial. Anterior compartment muscles, tibialis anterior, extensor digitorum hallucis longus, divided about 1 to 2 cm distal to your bone. Cut peroneal muscles, peroneus longus brevis, same level division. Deep peroneal nerve and anterior tibial vessels, ligated and divided posterior compartment muscles, gastrocnemius soleus complex. Keep this as a thick padding flap. Tibial nerve and posterior tibial vessels, ligated separately with the nerve. Cut under tension for bone resection and shaping. When it comes to bones, tibia, cut transversely 12 to 15 cm below the tibial tuberosity and beveled anteriorly. Fibula, cut 1 to 2 cm shorter than the tibia to avoid pressure points. Key structures to remember. Interosseous membrane, divide this anterior posterior tibial arteries, securely ligate these. 5. Myodesis and closure. The gastrocnemius soleus flap is brought forward and anchored to the tibia through drill holes. Myodesis, to pad the stump. Close the fascia and subcutaneous tissues in layers to minimize tension. Then close the skin without too much tightness to avoid necrosis. 6. Postoperative care. You might use a rigid dressing or immediate postoperative prosthesis, IPOP, for controlling edema and helping with early mobilization. And that's a wrap. Hope this gives you a clear picture of the Burgess BKA technique, making prosthetic use super effective. See you next time on the Everything Surgery podcast. Dissect the extraordinary.